Naman is a long distance runner who has recently started participating in half marathon races. He occasionally develops stiffness around his knees and has an old ankle injury. As a coach, trainer, or therapist, you try to check and compare the range of motion at the ankle, knee, and hips. You find a difference in the range of motion of both ankles. Is the difference in the range of motion due to mobility or flexibility? How do you further assess and monitor the joint mobility? If you're looking for answer to these questions, you're in the right place. Welcome to this course on physical medicine and rehabilitation offered by NPTEL. We are covering in this week about flexibility and joint mobility, and today's lecture is on assessing and monitoring joint mobility. You are with me, Wing Commander Chandrasekhar Guru. I'm a sports medicine specialist, associate professor in the field from Armed Forces Medical College. The learning objectives of today's lecture will be to understand the basics of mobility training, factors affecting mobility, and goals of training. We'll also look at various assessment techniques and their application, and we'll discuss a case scenario where you can apply these principles in your day-to-day practice. Why joint mobility is important? Joint mobility is essential for functional performance. It prevents injury and enhances the biomechanical movement of the sport. Further, it is also a vital key in terms of rehabilitation and return to sports playing protocols. When we look at understanding joint mobility, we have covered this in the previous lecture. Joint mobility pertains to active range of motion which is available at the joint, and it is influenced by the joint structure, the capsule, the ligament around the joint, the soft tissue, and the neuromuscular control. It is different from flexibility, which denotes passive muscle extensibility. So mobility is a bigger aspect of it, in which flexibility is a small subset of mobility. The various factors that affect mobility, again this we have discussed earlier, it's about the joint structure and shape. The more anatomical maintenance of the structure and function of the joint, better is the mobility. The capsule and the ligament compliance, obviously that contributes a lot to the maintenance of mobility of the joint. The muscle bulk and tone, again we discussed about this, how resistance training and increasing the muscle bulk can limit your range of motion. Neural activation and control, again since it's an active range of motion, it involves neural activation as well as control, which is the effector and the effector pathway of the neural control. And not least, the important aspect is the pathological changes that can happen in and around the joint, which can affect the mobility. So when we go in for training this joint mobility, we need to have certain goals, right? So when you look at the goals in terms of rehabilitation and sports performance, the major goal of mobility training is to restore the optimal range, because here I am not saying it is full range of motion. The range of motion is dictated by the sports demand. It depends on the requirement of the joint angle at that particular point when the movement has to be executed. The second important goal is to enhance the motor control. Better the motor control, the motor execution will be better. Improve the tissue quality. So obviously we have seen there are structures in and around the joint which kind of promote or affect the joint mobility. So the quality of the tissue in and around the joint obviously will have better say, especially in case of rehabilitation. It is important to get back the injured tissue to the pre-injury status as close as possible, so that the movement and the motor execution is to the optimum level. And the final thing is, mobility training helps in kind of maintaining the biomechanical, or rather it would, I would say, uh, uh, mobility training will help in kind of avoiding unnecessary biomechanical compensation that is tend to happen or bound to happen in case of sports training because of the specific need of a particular sport. So assessment in mobility is important because it helps in identifying these deficits early, and kind of instituting the right training helps in kind of preventing the biomechanical compensation as well. So when we speak about joint mobility, we need to know what are the types of mobility that is possible. One is the active mobility, where the individual himself or herself performs, whereas passive mobility is with the help of an examiner or an external resistance. So that becomes a passive mobility. So now moving on to the important crux of this particular lecture, that is assessment techniques. How do we assess joint mobility? There are various tools to assess joint mobility. First is to know the joint specific range of motion testing, right? So that can be objectively measured using instruments called as goniometers. So goniometers helps in kind of measuring the joint angle. You can also measure the joint angle using inclinometer, which is gravity based measuring equipment. You can also use a functional method of assessing the movement on the motor control by using functional movement screens, which is become more prevalent of late. And further, this is joint mobility is a function of the joint per se. It is important also to understand the accessory or the movement that can happen within the joint itself. So that is tested by various methods called as joint play, for specifically for the arthrokinematic measurement of this particular joints, the movement that is available at the level of the joint. So that also helps in kind of understanding the accessory motions that are available in a particular joint. So whatever be the assessment technique, it is important always to compare with the other side, so that you get an idea or a comparison with the changes that has happened. So the tools should be selected based on the goal that is required and the population that is being assessed. So let's see each and every one of this in briefly. So goniometer is a gold standard for range of range of motion measurement. So in this picture, you can see the goniometer has two arms. One is the stationary arm, the other one is the mobile arm, wherein one arm is fixed to the proximal segment of the joint where you are going to measure, and the center part of the goniometer is placed over the fixed anatomical bony landmark, so that it is fixed and the individual is made to move the distal segment. So that helps in measuring the extreme range of motion as you move the mobile arm along with the distal segment. So it is measured in degrees. The standard protocol, there are specific standard protocol, because this again can induce an error, measurement error. So it is important to follow standardized protocol to have same reliability of the measurement that is being done subsequently as well. So this is used widely in most of the clinics, sports medicine and physiotherapy clinic. This is important to identify the important tool to identify the range of motion measurement of a particular joint. So the it also helps in kind of documenting in recording it, and then you can see the difference or the change that has happened over a period of time because of a particular treatment or an intervention. Moving on next to inclinometer. Inclinometer is again a angle measurement device, but then it is gravity dependent measures. It has two types. It can be used with a kind of a bubble which shows the level where you will have to maintain that based on the gravity, and the other one is the digital level. So digital level obviously becomes more accurate in giving you objective data, and the application in terms of assessing is that more commonly it is used or helpful in terms of measuring the spine assessments. Coming on to the next important tool to assess joint mobility is the functional movement screen. It is more of a functional in nature, as the name signifies. It helps to kind of identify the asymmetries in the movement that is being made, as well as the joint mobility which is there in different joints. So this assessment is done using 7 movement patterns. The patterns are deep squat, hurdle step, inline lunges, active straight leg rise, and trunk stability push up, followed by rotatory stability, and finally shoulder mobility. So the entire range of joints are assessed in the body, and this aids to kind of give corrective exercise prescription as well. Say each and every one of this 7 pattern has been rated from score of 1 to 3. Minimum is 1, maximum is 3. So the maximum total score becomes 21, and whenever in each of the movement, if the score is 2 or below, you can give a corrective exercise prescription to increase it to the maximum level. So, a total of 14 is considered a cutoff, wherein less than 14 you will have to kind of do a corrective exercise prescription. And it has also been seen in various research studies that lower score is kind of predisposing the individual to more injuries as well. So, it becomes a good screening tool before starting the season as such, to know what is the movement pattern of the individual, the baseline, and thereafter you can include various movement drills on exercises and therapeutic exercises to further kind of improve this particular score. So, thus it's important to understand the deficiencies and then try to correct the asymmetries that is present in that particular individual. Coming to the next important thing is the joint play testing. Joint play testing is focused specifically to the particular joint to assess the accessory movement. So, when we say accessory movement, it means the arthrokinematic movements of roll. Say if this is a joint, so the movement that happens is the roll, wherein one end is rolling over the other one is glide, wherein there is translational movement. The spin is where it at a single point of contact the one segment kind of rotates, so that becomes the spin. So, these are the various movement that is biomechanically possible within a joint. So, you are able to test these movements using joint play techniques. So, each joint has a specific position at which the joint has to be tested. Generally, you fix the proximal segment and kind of move the distal segment and see what is the kind of movement available. It can be tested using traction technique, compression technique, or a glide technique. So, this basically helps in identifying what is the kind of room available for the segments to move within the joint. So, it is the capsule which gives the covering, right, and thereafter you have various ligaments that give the static stability to the joint. So, this kind of joint play testing helps to know or understand or assess what is the kind of movement that is available for the distal segments. So, the support given by the capsule and the ligaments can be estimated using this test. So, the next important is soft tissue assessment. As we know, it is not only the joint, the surrounding soft tissue it also kind of influences the joint mobility. Right. So, how do you assess this soft tissue assessment? You can assess using soft tissue palpation, basically palpating around the joint along the lines of various fascia and the ligament. You get to know whether there is thickening of a particular soft tissue or the superficial or the deep fascia. So, it helps to also assess various trigger points. If there is biomechanical correction that has happened because of change in the stress level or change in the kind of the force transfer or injury to a particular structure, or improper technique while pursuing that particular sporting activity. So, these all can cause undue stress in a particular structure. So, that can be assessed by seeing for looking for palpating for tightness around the particular joint. So, for example, you can get to know tightness of the plantar fascia by palpating along the line of the plantar fascia. So, that gives an idea what is the kind of compensation that is happening in a particular soft tissue. It also helps to determine what is the mobility available as well. It is not only important that you assess, but then it also needs to be recorded and monitored over time if you want to really need to have a progress or see whether it is progressing or regressing. So, it helps to have a baseline data and then how your intervention is working subsequently. It helps to kind of do periodical testing to see whether the kind of sports training imparted is right, the technique that is being used is right, or a correction that has been introduced for a particular technique is being yielding correct result or not. Further, it also can be used to kind of check what was the initial level, and then thereafter you give an intervention, then how it has kind of changed after the intervention. So, that it gives a objective kind of recording and monitoring of such changes that has been made because of an intervention. While doing mobility assessment, certain red flags that one need to understand, so that these red flag present means you will have to go for further additional evaluation. So, if there is pain when you are doing a mobility assessment, that means that there is some pathological thing that is happening. So, that needs further evaluation of that particular region. Abrupt end feels, when you are doing a joint play and then you feel that there is the end movement is kind of very abrupt, or there is a kind of a complete give way. So that means there's some problem pathologically, or the stability is not. So that then you will have to go in for further evaluation. If you assess, as we said, assessment needs to be done in both sides. When you compare them and see if the asymmetry is very gross. So generally less than 10% is considered okay if it is asymptomatic. But if still there are people, if an athlete has some symptom, even with 10%, you can also think of asymmetry as a reason as well. But then gross asymmetry, it's a red flag sign. So let's see the case scenario. We started this particular lecture with Naman, who is a long distance runner, who has recently started participating in half marathon. So he has that experience of participating in half marathons, a long distance runner. He said that he occasionally develops stiffness around the knee and has an old ankle injury as well. So what he would how do you check and compare the range of motion of the ankle, knee and hip, and then you find a difference also at the level of ankle. So how do you say whether it is because of mobility or it is because of flexibility, how to proceed further? So with kind of knowledge that we have kind of learnt in this lecture, let's analyze this case. So he's a long distance runner. He has history of old ankle injury, the stiffness around the knee. This is the main problem that he is facing. So we checked the range of motion and the mobility. So range of motion you can check using goniometer. You have an objective tool to assess the angle. So it gives you about the hip flexion, extension, internal and external rotation at the hip joint. At the level of the knee, it gives, you can assess the flexion at the knee and the extension at the knee. Generally, it's 0 to 130 degree to 140 degree of flexion. At the ankle, you can have dorsiflexion or plantar flexion. So these are the range of motion that you would assess using goniometer. You can also include one other assessment, say something where to see the structural integrity of the foot. So when the individual actually stands, because of the weight of the body against the floor, you have a kind of a method to assess how well the arches of the foot are maintained and how much is the mobility of the foot at the level of the talus, so and calcaneum. So that gives an idea how much mobility is available within the foot complex, because the foot complex has about 14 bones, and they all kind of work in tandem if you want to have a proper force propulsion to run. So that's again important. So that can be easily measured using foot postural index. So that again is a rating using 5 different assessment measures, and then you can give a rating. So again, positive ratings and negative ratings are given. Positive ratings means the foot is going into eversion or pronation. Pronation is that the foot is kind of going outwards, supination means the arches are well intact, and then it is this a high arched foot that becomes an over supinated or a extremely supinated foot will look like this. So that's how you can assess what is the kind of mobility available at the foot using a foot posture index. Flexibility, whether it is because of flexibility or mobility, you can assess by doing muscle length test. You can do muscle length test for the quadriceps called the Ellis test, hip flexors by Thomas test. You can do hamstrings check by doing a straight leg raise test. Calf check can be done. Iliotibial band, again an Hober's test can be done to check how much is the tightness or the restriction in the length of the iliotibial band. So these are common muscles that one need to check in case of a runner. So that gives an idea if the tightness or a reduction in the range of motion is because of flexibility or mobility. Subsequently, you can do a joint play or a laxity test can be done. So at the level of the knee and at the level of the ankle, because this individual, since he has reported that he had a whole ankle injury, it is important to check, because ankle injuries are prone for recurrence. So you might also need to ask how many times the individual had kind of sprained the ankle or injured the ankle. That gives an idea whether the individual has properly rehabilitated or not, and how frequently the individual has. The more the number of sprains, that gives an idea that the structures around the ankle joint have been damaged frequently. So that means the structural integrity or the stability of the ankle joint is questionable. So that again need to be checked by doing a joint play or a laxity test in the anteroposterior as well as posterior anterior as well as the mediolateral planes. So that gives an idea about the ankle joint mobility status. Corrective measures, if you have assessed this and identified whether it is because of flexibility related issue or it is because of a mobility related issue, then you go in for corrective measures, right? So the individual, if the individual has a ankle dorsiflexion problems and there is restriction in the ankle dorsiflexion compared to the other side, say, then in that case it would be probably the injured ankle, the calf muscle would have been tight, so that is restricting the ankle to going of dorsiflex. So if that calf tightness is assessed and it is found to be there, then you can go in for stretching exercises to kind of relax the calf and slowly over a period of time lengthen the calf. So then gradually you will find the objective increase in the ankle dorsiflexion. Say if you do a foot posture index, you get to know whether the individual is pronating or supinating. Again, mostly the injured joint is more prone for pronation because the control is not there, right, because of the frequent injuries. So there may be excessive eversion that is going outwards, and that can also kind of, the more the pronation or excess eversion means it is taking more time for the joint to lock the knee. So that is the kinematics that is involved in the kind of locking and unlocking of the knee as well when you actually land and push off. So that is again important. So if the knee is in kind of open chain position for a long time, so that means the time taken also is increasing. So that will again impact the proximal joint. So that may be a reason why the individual is having a stress on the knee as well. So that generally affect the lateral part because of the external rotation. So that can lead on to increased strain on the lateral side of the knee. So that should be a concern that one need to focus. So in that case, you can prevent pronation by kind of you making some footwear modification. How you can do footwear modification is a stabilizing footwear can be used, wherein it prevents unnecessary movement. So that movement can be prevented by stabilizing the foot. So that can be used, or you can use a heel counter kind of thing to kind of avoid the eversion of the calcaneum. So that again restricts the opening up of the foot complex. So that can be used as this thing, and obviously you need to also have active control, right? So because of the injury, the foot muscles also would have been weakened. So strengthening of the foot muscles also will give good result. If there is, say, if at the level of hip, if there is reduced hip flexion, then it is important to look at the hamstring tightness and then try to kind of address this as well by stretching exercises. There may also be ITB tightness. So ITB tightness is one of the common problem that runners and cyclists face. So there you will have to kind of check for the tightness. Local soft tissue examination shows the tightness around the IT band at the level of the lateral or the outer aspect of the knee. So that means you can include certain foam rolling techniques so that self myofascial release techniques can be used. Exercises can be given, therapeutic exercises to stretch the iliotibial band as part of the cooling routine can be undertaken. Even stretching of the gluteal muscles also can kind of help this particular cause. Ankle joint, old injury, as we had been discussing, there may be excessive movement as well. So again, joint play will give you an idea how much is the mobility available at the accessory motions that is available at the ankle joint, plus the muscles around the ankle joint which causes the eversion, inversion, dorsiflexion and plantar flexion may also be weak because of the injury. So if at all the individual has not been properly rehabilitated, so it is a time to kind of focus on it and try to strengthen these muscles. An important aspect in ankle joint injuries are the proprioceptors are also disrupted. So it is also important to address this proprioception as well. So proprioceptive exercises, balance and mobility drills, this again can give you can assess this using functional movement screening. So that also gives an idea if there is restriction in the squatting. So maybe because of the reduced ankle dorsiflexion. So addressing that also can kind of giving corrective exercises can help in kind of addressing this problem and identifying whether the problem is because of flexibility or mobility and targeting the identified problem. So that gives a good heal as well. So following such a a proper schematic and a flowchart based approach will help in kind of preventing the injuries as well. So it helps to kind of avoid early detection of the deficits and the limitations can be done. It prevents the injury by you can also prevent injury by kind of including mobility programs in the warm up as well as stretching programs in the cool down, and conditioning drills kind of properly curated and selected exercises for general warm up and specific warm up as per the sport can also kind of prevent injury. With the advent of or fast booming technology sector, it is kind of going to complement your monitoring aspect in terms of mobility. So you can kind of use digital goniometers, digital equipment and tools, technological tools to kind of objectively measure it. You can use wearables as well as motion capture technology to further enhance your capturing of parameters that can be correlated with the other parameters as well. It also kind of helps you to monitor real time and as well as kind of remotely as well. So thus incorporating technology kind of helps in manifold better outcome in a sports scenario. So whatever be the kind of assessment technique, if we are not focusing on the sport specific demand, then that may not yield you the appropriate optimum performance, right? So it is important to focus on specific needs of the sport. Say overhead athlete, then you will have to focus more on the accordingly with the range of motion at the optimum range that is required at a particular joint, say shoulder joint and the scapular thoracic joint. Endurance sports, it needs a different kind of approach. Contact sports would need a different kind of approach. So it's important to consider these aspects. So mobility is essential for optimal function. Assessment and individualization are key. The assessment of range of motion, joint play, soft tissue help to address the cause, and holistically it has to be included in the sports training program so that the impairment and deficits are addressed at the earliest. So that kind of also helps in improving the performance as well as lowers the injury risk. So for those of you who are further interested in in-depth reading of these particular aspects, I would encourage you to go through these references. They are wonderful references which are available. Thank you for listening. Jai Hind.